Hello, and welcome to part 6. Where we left off, we were looking at the hip bones, which are called os coxae. This is one os coxae, this is another os coxae, and they make your hip together. And in reality, it's 3 bones that fuse. The pubic bone is this anterior bone right here. It meets the other pubic bone at the pubic symphysis. The superior bone is the ilium. You could feel your iliac crest back here. And remember in the scapula video, I made the comment that when you are social dancing, your hand is under the spine of the scapula, not the ischium. Well, the reason for that is the ischium is the posterior bone back here. So we are looking at landmarks. This is the pubic turbicle. That is a landmark because the inguinal canal is basically right there with a nice juicy vein to stick needles in. This is the inferior pubic ramus, pubic symphysis, superior pubic ramus. I'm not a big fan of the pubic ramus because we have the ischial ramus connected to it. Technically inferior ischial ramus. Most textbooks ignore the superior one. Then we have the ischial tuberosity down here. So this is the ischial tuberosity. The acetabulum is the socket formed by all 3 bones, and the obituator foramen is formed by the pubic and the ischium with their rami. So our ilium, this is our iliac crest, and we have our sciatic notch right there where the sciatic nerve passes through. We have our spines, 1, 2, 3, 4. Now our internal surface, we have our auricular surface right there that has a joint with the sacrum, and then this is the iliac fossa, where the iliacus muscle attached. So let's talk about sex of the pelvis. Remember on the last video I said, oh, this pelvis is female. Well, this one is male. And I know that besides all the bone boxes are male. See this angle right here? It doesn't have to accommodate a 10 centimeter head passing through. So it's a very small angle in males. In women, you actually have a larger sacrum. The sacrum is wider in women. So this angle becomes much, much greater. That's how I knew just looking at that diagram. So in men, the angle of the 2 pubic bones is less than 90. In women, it's more than 180. Now, our iliac crests. They are narrower because they stick up more, so they're higher. And they tend to be thicker. Men have stronger muscular attachment in their legs. They did not have to modify their skeletons for childbirth, so they have these nice, powerful legs for running and walking. Now, this clamp isn't making this very nice. This right here is allegedly a circle. So in men, it is spherical because they have a narrower sacrum here. In women, the sacrum is pushing the bones apart, so this is oval. And their iliums tend to be a little bit wider and farther apart. What I like to do in lab, I didn't bring these home with me to make the lecture. I take the fetal skull, I try to stick it through the male pelvis. It doesn't fit. I take the fetal skeleton, it's a fake skeleton, don't worry. I stick it through the female pelvis, no problem, there is room to spare. So all of this is modifications for childbirth. And since we're talking about sex of skeletons, I might as well show you the skull again. This is the occipital protuberances. These are technically the nucleal lines coming off of it. So nucleal lines, occipital protuberance. In men, it's much more raised than in women. And one of my students last semester asked me, what's a 10-year-old boy going to be like? So I chased my 10-year-old around for about 3 hours until he got tired. I actually had to bribe him with a donut. And then I was able to see, oh, a 10-year-old boy, they're making testosterone. It's starting to increase in size. So now you know, and my son is still pissed off at me. So on the test, I'm going to ask you the difference between the male and the female. So the woman has a larger angle, so over 100 degrees versus 90 degrees. The opening there is more round, or oval in women, and more round in men. You have taller and thicker iliac bones in men. In women, it tends to be flared out and lower down. And those are the main differences. And it's all actually because of the sacrum. That sacrum is wider than that sacrum. So in lab, we'll look at both the male and female pelvis. And I'll show you the models that are perfect. At one of the schools I used to teach at, their male pelvis actually had a very large inlet and a very large pubic angle, so it took a little bit of time to figure it out until you looked at the female right next to it. So I have two femurs right here. That's a tibia. And we are looking superior to inferior. So this is a right femur. On the proximal end, so this is anterior, we have a head. And look at that beautiful neck. Guess where it breaks? Yep, that neck. So a head and a neck. And this is the only bone that has trochanters. This is the greater trochanter that is lateral. And this is the lesser trochanter, which is posterior. So on the posterior view, we have the head, we have the neck, we have the greater trochanter, which is lateral, we have posterior, the lesser trochanter. And this is the intertrochanter line. Muscles, 5 zillion of them, attach either the greater trochanter, lesser trochanter, or this line. So I want to direct you to this triangle now, right underneath the lesser trochanter. There's a triangle shaped like that, and that is the gluteal tuberosity. You have a gluteal muscle attaching there, and it's actually attaching to this entire structure. You see there's a line running all the way down there. That is the linea aspera. We'll learn about the linea alba later, named for Jessica. This is the linea aspera. The gluteus maximus and a couple of the adductor muscles are going to attach here. So these are very important landmarks. Gluteal tuberosity muscles attached to, mainly gluteal muscles. And we have the linea aspera, which the gluteus maximus and the adductor magnus attached to. Now I want to rotate this bone a little bit. This is not on my slide because usually our bone boxes, the bones don't have it. There's a nice little nutrient foramen. In the real bone, this is a very obvious foramen that tends to get smoothed over by handling. And there's another nutrient foramen right there. This is our distal view. We have the patellar surface right there. Guess what bone's there? That's right, it's the patella. And then we have two condyles. Remember the condyle and the trochleella of the humerus face to the anterior? Well, these face to the posterior. So this is how the bone would sit. This is the anterior surface, that's the patellar surface. So the condyles are on the posterior. The condyles are going to form a hinge joint with the tibia. And when you flex, you cannot see a single thing. When you flex, that is flexion. So I am flexing this way. So I would actually be bending my knee backwards if I were to flex. And that is something very important when we get to flex and extend. When you flex your arms, they go forward. When you flex your lower leg, it goes backwards. No, it's not a pet peeve or anything. Now, these condyles, like the humerus, have epicondyles. You have one epicondyle here, one here. The epicondyles are named medial and lateral. Same are the condyles. So this is the head. The head is medial. So this would be the medial epicondyle, and the medial condyle is behind it. This is the lateral epicondyle. Let's move that in more so you can see it. So this would be the lateral epicondyle, and the lateral condyle is underneath it. So we have a head right here. And we have a neck. Again, the neck is where the breaks are. And this one is anterior, this one is posterior. The greater trochanter is always going to be lateral, and it is a humongous trochanter. It's a beautiful trochanter. Lesser trochanter, I'm not a big fan of. It's lesser. I'm such a snob, aren't I? Now, there's a intertrochanter line between them, and you have a lot of muscles that attach here, here, or here. Sort of like the interturbicular sulcus and the greater and lesser tubercle of the humerus. It's a very busy junction. Now you have the linea aspera right there. That's the line going down. And then you have a triangle at the top called the gluteal tuberosity. The gluteus maximus inserts on this entire line right here. And you actually have the adductor magnus coming in as well and attaching to that line. The condyles, the posterior. So this is one condyle, this is another condyle. Since I could see my head here, that's the medial condyle. That would be the lateral condyle. Now, on the sides of the condyles are the epicondyles. So lateral epicondyle would be on the side of it. And then the patellar surface is that smooth surface right there. So let's meet the patella. Your patella is your kneecap. And contrary to all those gangster movies, you can walk without it. You just can't be very powerful in your legs. So there's a point here called the apex. We're going to learn other apexes later. So apexes in epithelial tissue is this top surface. Everything else is going to be a pointy thing. So the apex is the pointy part. The base, it's all about the base, is here. That's the rounded part. And the back is different from the front. You have an articular surface. You actually have facets on both sides, which we're not going to worry about. And that really is articular surface, whereas we have ears in our ilium and our sacrum. Now this is the back. I do not know why this picture came with a back side. But here are the condyles, which are posterior, and they are going to meet up with the condyles of the tibia. So let's look at our kneecap. Here are our kneecaps. This is the right one, this is the left one. And this is the apex right here. So see how the apex is pointing, and this is rounded. So how can I tell that it's left or right? Well, I take the pointy part, which is the apex, I stick it down, and I see which side it falls to. This one is going to the left, so it's a left. And the other way I could tell, this one has an R on the back. Now you can see the articular surface right here is smooth. There are a couple facets for articulation with the patellar surface, where this part is more roughened. And that is because the patellar tendon becomes the patellar ligament, and you have all this attachment point of it going through the patella. So that is our patella, and that is our femur. Thank you. Let's ask some questions in 2 minutes. The os coxa is made up of what bones? It's all three of them, so D, all of the above. The blank articulates with the ball or head of the femur. So remember, it's the one I like saying, acetabulum. The blank is the attachment site of the patellar ligament. Just kidding. That's why I should probably pause this before going to the next question. The bodies of the two pubic bones are joined at the, do you remember what I said? Pubic symphysis. So that's an important joint that we will talk about when we get to the joint chapter. So that's all the time we have. We have 2 more videos. You've got the pattern, haven't you? The first video is going to be the tibia and the fibula. The second video will be the foot. So thank you.